Or pancreas,
Yeah, transverse epigastric area,
right under the sternum.
right under the sternum. And your probe is slightly oblique, not perfectly transverse. You want to turn the notch down just a little bit. And we can look at the screen. I'm just going to increase my depth. So this is the pancreatic head. We see the body here and the tail right here.
It's better if the patient's fasting.
It's better if the patient's fasting for pancreas, but that doesn't always happen. Important thing is for a lot of patients is the pancreatic head. So this is sagittal. I just turned the probe in a sagittal or long position. And that helps me be able to evaluate the head of the pancreas. Let's increase this a little bit more. And then I slide down just a little bit and I can see the body of the pancreas. And then the tail. And when I'm scanning the tail in the long position, again, I'm slightly oblique. I'm not completely straight on the patient's body. So for the tail, I take the end of the probe and rotate it slightly this way. So your probe's almost at like a 1 o'clock on the clock. And we see the pancreatic tail. Pancreatic tail is harder to see with ultrasound than the head or body typically. So some patients, you may not see it. One trick you can do is have the patient drink a little bit of water. It'll fill in the stomach, and just like the bladder acts like a window for the uterus, the stomach with water in it can act like a window to see the pancreas, especially the tail. When I want to scan liver, I start in the sagittal position, almost the same place. We can see the pancreatic head is here. We don't normally measure the pancreas unless the head looks really enlarged, then we might measure it. Sometimes you'll get the pancreatic duct in here. So if you see it dilated, you can measure it. And then we go to the liver. I want to say 3 millimeters, but I'm not. When evaluating the liver, you can have your patient take in a breath. Come on, you breathe. And so I can actually see the entire segment of the left lobe of the liver here. You want to be sure you sweep out all the way towards the spleen with your probe in the long position. And this is all from the epigastric area. So I want to look at the edge of the liver. Breathe, come on. All right, take a deep breath in again. Landmarks we're looking at with the left lobe, we see the aorta. Keep coming over, you see the caudate lobe, and then the IVC, or inferior vena cava. If I've swept through all of those, I know I've covered in long axis the left lobe segment. So you can decrease your depth. I always take one picture of the right lobe here. When I'm imaging, I drop my focal zone down if you have a focal zone, because we're going to look at the posterior portion of the liver. So come on, you take a big deep breath in. And I can see here, decrease my depth a little bit more. The right lobe, it looks pretty smooth, homogeneous. You see it here. So I just sweep through. This is not where I take my measurement, though. All right. For the next view in sagittal, I come intercostal to the patient's rib space on the side. So this is going to be my window where I'm going to be scanning sagittal for the right lobe. If you only scan from the epigastric or xiphoid area, you'll miss a lot of pathologies that are more in the right lobe. So you want to be sure that you come intercostal as well. So for measuring, some people measure here. Where I was trained, we measure at the liver-kidney interface. So it kind of depends on where you're working. Deep breath. So when you're measuring, you'll hit your caliper. You want to measure from the inferior edge all the way back to the superior area. Try to get a long measurement. So 14.7, that's pretty normal. The criteria used to be 15 centimeters or 150 millimeters. I think a lot of places now have increased it to 16 centimeters or 160 millimeters, being normal. Deep breath in, and again, we're just sweeping through. Make sure we see all of the anatomy. You also want to be sure you come up and get your superior portion of the liver. Make sure you're not missing anything. I like to see the dome of the liver in transverse. We'll get a view of that in just a couple minutes. Next, we're going to pretty much repeat the windows in transverse. So notch towards me, come back here. Again, I am slightly oblique. I have the notch pointed down and the end of the transducer pointed up a little bit. I'm going to decrease my depth back, and I'm going to evaluate the left lobe and transverse. So deep breath in. Just turn this down a little bit so you can see. So I want to again be sure that I'm evaluating the entire left lobe. We can see here the hepatic veins, right? Breathe in. I'm going to have you do it again, sorry. Middle hepatic vein, left, and then we can see IVC here. If I sweep down just a little bit, that's my left portal vein. We call it the portal T. So I know that I've got left portal. And if I keep coming down, I'm getting into right lobe, and we see here the main portal vein, hepatic artery, and breathe. And big deep breath. Again, I do the same thing. I just sweep through the right lobe